Dear colleagues, yes, ladies and gentlemen, thank you for coming to one of our functions of AMA, Armenian Medical Association. It was great pleasure for us, and we are so lucky to have with us Dr. Nooshig Salvador from Chicago. She's a palliative care specialist, and also she's a specialist in Chinese medicine and pain management, Chinese versus holistic medicine. Nooshig has various hats. She's a director of Edward and Elmhurst Hospital of Palliative Care, and she has several other hats, which if it takes me the whole evening to read them. However, she's also very active in Armenian church in Chicago. You have an Armenian community, and just like us, she goes various places and gives lectures to various people. So short introduction, we are so lucky, and we are just grabbed her as an opportunistically Nooshig to deliver us this lecture on management of palliative care. Nooshig,
thank you.
This for you.
Thank you, everybody. So I'd like to get a little bit of a understanding of the audience that I'm giving this presentation to. How many individuals who are in medicine, practicing in medicine? Okay, so everybody else is non-medical.
More or less 50-50. Or
okay.
No, I would say 60 medicine.
That's okay. I just need to know so that I'm cognizant of the type of words I use when I'm describing what I need to describe. I've been asked if it's okay to hold your questions to the end, and then we can have a spirited discussion as you like. So, as Dr. Seta said, my background is in palliative care. My original foundation is internal medicine and pediatrics. I actually did more of the internal medicine, less of the pediatrics throughout the years. And as I was practicing as a hospital physician in internal medicine, my dad fell ill. He was diagnosed with pancreatic cancer. And I met a nurse who was a palliative care specialist who it just enticed me with what she knew about palliative care. And much like many individuals, we think that palliative care is end-of-life medicine and end-of-life care. It is not. Palliative care can start when the beginning of the diagnosis is given, which can be years before any of the end-of-life aspect. And so if there is anything that I'd like to oh.
No, you press it there. No, that's not working. You have to press there.
If anything, this is the pointer. So if there's anything that I'd like to teach you all, it's not just about integrative medicine, but also with palliative care medicine, that one of the objectives also would be that you all know that it's more than just end-of-life care. It's very much about quality of life through the trajectory of the disease, which could be days, months, weeks, years, it could be decades. Maybe you don't need palliative care after you're stable or cured, and then return to palliative care because another diagnosis or worsening of the original diagnosis. So palliative care can be something that you utilize along with the specialist, oncologist, cardiologist, neurologist, so that you focus on quality of life of the individual. I found that through my knowledge of knowing more about palliative care medicine, my dad was taken care of not just because of the cancer. He was taken care of because of a very spiritual part of himself. And that was a very important thing to all of us in our family, that the spirituality was looked at and respected. And with that came healing through a very spiritual, mental, emotional, and physical level. And this is what palliative care strives to do, more than just end of life. So we recognize symptoms that are related to the chronic illness. In order for you to be a candidate in palliative care, you should be diagnosed with something like congestive heart failure, heart attack, stroke, MS, cancers of the advanced stage, things like this, in order to be considered a chronic illness. Now, I'll also define what is integrative medicine. To integrate the ability, not just what we call complementary and alternative medicine. Alternative means it's either or. But integrative means you're integrating Eastern, if you wish to call it Eastern, or non-conventional methods with conventional methods. You integrate them. Much like how I described with my dad. It's not just treating his cancer. It's the depression and the isolation and the sadness and all that comes with it, the fear that comes with that diagnosis. If we don't treat that, we're not treating the whole person, right? I hope I make that message clear. There are, there are benefits to holistic medicine. I know that for my Western colleagues, that's going to be a hard pill to swallow. Hopefully I can introduce you to the benefits of what holistic approach can do. It's been very, very fascinating with certain individuals who use a holistic medicine along with conventional medicine, because we're not here to say do either or. We're here to integrate. And everyone is different, everyone is special, everyone is unique. We use it, we tailor it to the person. We should appreciate the synergistic value of both conventional and non-conventional methods to palliative symptoms. We'll go through that, related to chronic illness. And we appreciate that non-conventional methods have potential to decrease the side effects of pharmaceuticals. And so guess what? If a person is on chemotherapy and they're getting nausea and vomiting, maybe they're a candidate for acupuncture. So if they get acupuncture and they treat the nausea and vomiting, they don't have to wait and hold off and delay their chemotherapy. You don't have to decrease the dose because you are integrating both methods. You're respecting both methods. And we'll review some of that. So next slide. Thank you. So palliative care, any person who's been diagnosed with a serious chronic illness, prostate cancer with metastasis, stroke with some debility. We benefit from what we call a goals of care discussion, which can start years before the person is even at end of life. We are used more at end of life because that's more of what we tend to use palliative care as if it's hospice, but we're actually a separate service from hospice, at least in the US. I'm not sure about how it is here. But what I'm going to tell you is going to be a lot about what I know in the US too. So we benefit from advanced care planning. So what does that mean? That means that if a person went through a stroke, would they want resuscitation at end of life? Would they want CPR? Would they want those things? If we don't talk about those things, it will be done to you even if you didn't want it, because no one knows. So advanced care, meaning in advance, we talk about these types of things because the person might say, I'm at a place where don't do those things to me. God takes me, I hear all kinds of things. You know, I saw Dad go through this. I saw my sister, my neighbor. Don't do those things to me. Some people would say, oh, come on, do everything. What's wrong with you? Why would you ask me a question like that? Okay, your advanced care planning says to do CPR then when you're at end of life, right? So this is important to have this way before the problem gets to that level. And they benefit from treatment of symptoms, pain, headache, back pain, neck pain, nausea. All of these things are things of which individuals in advanced stage of cardiology in CHF, bad heart disease, stroke, bedbound, cancers, any one of those things are, we tend to focus more on certain things like pain for cancer or shortness of breath for congestive heart failure, but really as we get older and as we experience more problems, a lot of these, doesn't matter your diagnosis, you're going to end up with a lot of these issues. So in palliative care medicine, we treat symptoms related to the chronic illness, right? If you can go to the next. So, well, what do? We use conventional methods. We use conventional methods. What does that mean? There's pictures right there. Pharmaceuticals. There's people who take that many medications per day because they have 13 different diagnoses, right? So what do we have here? I know it's paracetamol. I think for US we use acetaminophen. Either way, paracetamol, NSAIDs, opioids. Ondansetron is just a big word for Zofran, which is an antiemetic, so it helps with nausea. Prochlorprezine is a compazine. But basically, these are all pharmaceutical medications to treat symptoms. And if you're going to be in palliative care, it's because these symptoms are related to the illness that you've been diagnosed with, right? Okay, so this is conventional. If you can go to the next one. So, integrative medicine. What is integrative medicine? We're looking at things that are considered non-conventional. So, basically, not the pharmaceuticals. We're looking at mind-body modalities, nutrition, phytonutrients, the microbiome. Who here, if I could see a show of hands, has heard of the microbiome specialty? A few. It's getting bigger now because understanding more in the macro and the micro level of what is happening in our guts when we put certain things into our stomachs, and this connection that happens throughout our whole body through our stomach, which I'm going to tell you, by the way, the ancient Chinese have known for thousands of years, and we've ignored, and we're coming back to that. So very interesting. There's environmental medicine, there's traditional Chinese and Ayurveda. I'm not going to get into Ayurveda, but Ayurveda basically is the ancient medicine that was practiced in India. And they look at herbs, and they look at mind-body modalities through yoga and things like this. And what I'd like to talk about today is I have slides to talk about nutrition, which will kind of cover the phytonutrients and the microbiome. We'll talk about mind-body spirituality towards the end. And I'd like to focus a little bit more on the traditional Chinese medicine because my background is that I did 4 years of graduate study in traditional Chinese medicine, got my graduate degree in traditional Chinese medicine, and I've been fascinated by the things of which I learned through their modalities to help in integrative medicine. So if you can go to the next slide. Integrative medicine is healing oriented. That's really what doctors should be doing. We should be healers. We don't call ourselves healers. We don't. Maybe a few do, but as a group we just don't, and we need to. We need to get back to the aspects of healing when we talk to individuals. We take into consideration the whole person and aspects of lifestyle. Our lifestyle is something we have to strongly consider. If we don't, we're missing the big picture. We're just going to continue to prescribe more and more pills, unfortunately. So it emphasizes the therapeutic relationship between the doctor and the patient. So you yourself as the practitioner needs to take care of yourself. You need to be the healer. Physician, heal thyself, right? We need to heal ourselves too in order to have that energy passed on to the people that we're trying to heal. So that also takes that into consideration. So Dr. Andrew Weil has been an integrative physician for decades. He's the physician that started the Integrative Medicine Fellowship, of which I'm in right now. God willing, will graduate at the end of this year. And where I'm learning a lot of these aspects, including traditional Chinese medicine, to help our patients so that we treat their symptoms for their chronic illness. So, integrative medicine does not reject conventional medicine. I'm a medical doctor, so I'm not going to talk about how pharmaceuticals are bad for you. They can be if it's too much, but then so can too much acupuncture and too much food, too much wrong food. So it also looks at, it doesn't reject the alternative therapies, but we look at them with a critical eye. We have to, because it's all about balance. It's all about risks and benefits. Good medicine is based on good science, but we're open to new paradigms. You got to be. Because just because there was no randomized control trial done on it doesn't mean it isn't good for the people that you're serving. We have to be open to these types of things as long as they're safe. It's the appropriate use of both conventional methods and non-conventional methods. It understands that the body actually has an innate healing response. This is the way we're created. We have an immune system. We have a mind, and we have the ability to actually allow ourselves to heal in some aspects. We might reach out for more, but we've gotten away from that power. And individuals who practice integrative medicine should commit themselves to self-exploration and self-development, because again, we are also we need to heal ourselves as we're healing individuals. The holistic approach, what is this? Well, we're not only looking at the physical aspects, but we're also looking at the psychological, the spiritual, and the social. A lot of our patients diagnosed with congestive heart failure, the more shortness of breath they get, the more isolated they become. They are not able to play golf the way they used to. They're not able to be in families functions the way they used to. They get more isolated. They sit in their house. I don't want to go. I don't want to go. It's not just their symptoms of shortness of breath. This overwhelming sadness, this emotion. There's this relationship I never healed with this person, and then there's this guilt. There's too many things going on in a person's mind, in their experience, and not just the diagnosis itself. So you have to look more beyond the physical. You have to consider all these things as part of the spiritual, the symptom domain. So, what I'm here to hopefully help everybody understand, and I think we probably do understand this, we just need to get back to talking about it, is the relationship between inflammation and health. What is the enemy when it comes to disease? If you summed it up with one word, it would be inflammation. Inflammation is the enemy. Inflammation can be caused by any of these things that are considered pro-inflammatory. These are processed foods, high fructose corn syrup. If you lead a sedentary lifestyle, stress. Stress is awful. Stress is just awful. You can be a self-professed vegetarian or vegan, but you have stress in your life, and you run and still have a heart attack or a stroke. And what we fail as doctors, as medical doctors, we say, this person had a genetic predisposition. That's true. That's probably true. But then everybody goes, why is it with that person who had such a wonderful lifestyle with nutrition and runs every day, have a stroke or a heart attack? That person, if you really spent the time with them, more often than not, what I see is stress. Family situations, financial situations, work situations. That's why they run. They want to not look at something like that or dwell into it. So running helps them feel better. And they think with the diet that they're doing that this is, I'm free from any possibility of disease. We need to be holistic. We need to look at all aspects. We refuse to not look at one aspect, we're in trouble. Yeah? Poor quality sleep and insomnia, right? Any of these things, processed foods, anything that comes in a box, anything that's going to be sold in a store that's in a bag, is there because of shelf life. So that's the benefit of the company. It's not meant to benefit your cells or your DNA. It benefits the company by saving money because they're able to, this shelf life can last for years, and this is what we're putting in our bodies. So what is anti-inflammatory? Well, whole foods that are plant-based. And you have to buy the right ones. The organic ones, non-GMO, there's all these different names. But you should be cognizant of those things so that you know that the anti-inflammatory stuff is way better than this. Now, I got to stop a little bit and just make sure that I say that we have to be realistic with our goals because it's hard. It's hard to just give all this up, right? So, there's a way, there's an approach. You have people who are, your patient may be motivated right in front of you. Huh? They can probably do all this, stick with it, bravo, right? Yeah, and you have some people who are going, I don't want to do that. I like my food. I like my chips, I like my salt, I like my this, just give me the pill. Okay, we'll work together, we'll introduce, but that person's not ready for these types of things. So we're not ready, we're not going to push something on that individual until they're ready, if they're ever ready. Gentle movements, active lifestyle against a sedentary one, meditation, prayer, mindfulness versus stress and restful sleep. This, if you guys ever see Time magazine, this actually came out, you can't see this up here, I think it was in 2004. What was that, 16 years ago? 15, 16 years ago, and they knew, or we knew, that inflammation was actually the link to a lot of these things. Alzheimer's, cancers, heart attacks. Smoking, inflammation in the lungs. Processed foods, inflammation in the heart. And anywhere else in the body. Yeah? So we actually knew more about this before, and now we're starting to get to a place where okay, something is definitely wrong. We're not approaching this the way we should be. If you can. So, what is the integrative approach when it comes to, say, nutrition? Well, we already talked about that. Movement, there's things like breathing exercises, Tai Chi, yoga. TCM is traditional Chinese medicine. There's acupuncture, there's Tui Na, which is a type of massage. There's touch therapy. Sometimes, you remember how Mom used to just kind of stroke your scalp? And you go, oh, that feels so nice, right? There's something to that. There's something with the body feels good when you're doing simple things like touch therapy or being with family and that feeling of being with family, right? Mind, body, especially prayer, right? You know, individuals who are really deep into prayer, who utilize it in a way that's their downtime, yeah? So, whether it's palliative medicine, whether it's neurology, whether it's GP practice, whether it's cardiology or oncology, we always look at the burdens and the benefits. If that medicine has too much burden and very little benefit, abandon the thought of using that medicine, unless you have no other choice and you understand these burdens exist. Take them. You're willing to take the consequences. Same like with integrative medicine. In integrative medicine, you're going to look at the benefits and you're going to look at the burdens, just like you do with pharmaceuticals. Any treatment should always you look at with the exercise and the approach of what is the burden of it and what is the benefit of it. If the benefit is high and the burden is low, it's worth doing. It's worth exploring. So palliative symptoms using non-conventional medicine or treatments. You know, there's more and more of these articles that are coming out where we're looking at all these different aspects. People are actually looking at these things along with conventional medicine. So traditional Chinese medicine like acupuncture, herbs, cupping, if you guys ever heard of that, along with all these others. Social prescription. I just read recently that hospice here, the hospice organization here, did this very nice out-of-the-box treatment.
What are we doing in the primary care now?
It's beautiful. I love it. Sending people to gym, to social activities, and giving them a, just like a pharmaceutical agent. Yes. Bravo, guys. Bravo. Because this is what we're in trouble with as we get older and as we continue to get sicker and sicker. We ignore these types of things as we should look more into these aspects. Next. Oh, yeah. It's okay. Keep going. There you go. So what is traditional Chinese medicine? It's actually the oldest codified system in the world. It's been there for thousands of years and was actually written down in books where it was studied by major ancient Chinese physicians. And it systematized their medicine in more of an experiential observational method. The randomized control trial, which is touted as the greatest type of trial that you can do for medications and for treatments, are a very new concept. So the Chinese actually used experiential observational studies. And by thousands of herbs and by acupuncture points throughout the body, they found individuals were feeling better and actually doing better by their experiential methods. So there's something that we shouldn't just put that aside because the RCT studies are actually the greatest study in the world. We should actually look at that too. We should consider that as well. So it's based on the principles of what they call yin and yang. Yin and yang is cold. Yang is hot, cold, hot, interior, exterior, empty, and full. I started my graduate studies in traditional Chinese medicine after 20 years of being a medical doctor. And it took me maybe a year and a half before I started to understand this concept of treating people in Chinese medicine. The students who were there, who were not medical doctors, who were accountants or bankers or whatever, they changed their minds, they wanted to go in traditional Chinese medicine, they were able to actually get this concept because my mind was so ingrained in the Western concept that it played with my head So what I have to say might play with your head. So my apologies. It took me a good 4 years to get these concepts. So, this is the basis of how the Chinese, ancient Chinese looked at disease. So if you're able to read them, because I'm not sure if the letters are good for you to see, but on the top there is the concept of the heart. We think about, when we say heart, liver, spleen, kidney, we think about the organs. Sometimes traditional Chinese medicine meshes with the concept of the organ itself. Most times, it's a concept. So that was one of the problems that I had as a physician going to graduate school learning this, is that I kept thinking of the actual heart, the myocyte, right? When I was told about studying the liver and the gallbladder, I would think of the hepatocytes. I would think of the structure of the liver and the gallbladder. The concept of the liver and the gallbladder is what the traditional Chinese use. And so if we took this as an example of what the Chinese, their approach, the liver and the gallbladder, where they see individuals who harbor anger. So if they're standing there and you see them, you can just see anger, like the cartoons with the smoke coming out of the ears, you see people with this anger. And then that person at some point says, my chest hurts. The Chinese concept would say, okay, we're having the emotion of anger. This looks like a problem, an unbalance of the liver, the concept of the liver and the gallbladder, and you see this arrow here, and these arrows. This is affecting areas of the concept of the heart. Even though it's chest pain, how many individuals have we seen in the ER where they're angry or they had an argument, they come and they can't breathe, they're holding their chest, and we're looking at MI, we're doing all the studies, EKGs, blood work, and everything like this, and then when you really get to what happened, I had a fight with my wife, and then this started. So again, in the ER, we might ask that question, but what do we do about it? We give them a Valium? Give them a Xanax? More pills? See? So it's important to consider every one of these concepts has some sort of emotion tied in with them. So fear is going to be something of an imbalance to the concept of kidneys. So they have these colors. They have issues that are related in these aspects to each of these concepts. And these arrows talk about how one concept of an organ system affects another concept of an organ system. Again, very odd ways, new, just doesn't make sense to us, but it works from a traditional Chinese aspect from this approach. So if you can. So the history taking in traditional Chinese medicine is actually similar to Western medicine. You do history, you do review systems, but you add on the questions about emotion. What's your emotion like? Are you fearful? Are you sad? That's important in getting to the diagnosis from a traditional Chinese aspect. Are any of these things occurring in your life? There's the 10 questions, which is very similar to the Western approach. But there's also the tongue and pulse. And I have to tell you, in terms of the tongue and pulse, I was fascinated with this. When I first was in school, I said to myself, yeah, okay, sure, I was a medical doctor. I'll jump through your hoop and learn about the tongue because I need to get my degree and get to the acupuncture, right? But then I started seeing patients. And I recognized that their symptoms, their emotions, their fears, their anxieties were related to problems with the tongue. I wasn't trained like this in my residency. I looked at the tongue and I said, get out of the way. It's too big. I can't see the real structures. I can't see the uvula. I can't see the back of the throat. I can't see the buccal mucosa. The Chinese aspect takes very seriously what the tongue looks like. And the more patients I saw, the more I could relate to each one of these problems: qi deficiency, issues with heat, damp heat, yin deficiency. When I saw women who went through menopause and were complaining of very bad hot flashes, if I took a look at their tongue after years of this problem, they tended to look like this. How do I explain how the Chinese knew that this is important? I never looked at that. As a Western doc, if they had thrush, you treated the thrush. Otherwise, get out of the way. Let me see what I really need to treat, right? So tongue. Tongue is a very important part of the physical exam when it comes to getting to the diagnosis. Another thing is the pulse. Very intricate system of experiential method and observational methods, seeing how by feeling in this aspect, you have different types of pulse in different individuals that you take with that physical exam, the tongue physical examination with their emotions, their symptoms, their feelings, and put that together to come to the traditional Chinese diagnosis. Now, why is that important? Because the diagnosis is important because that's how we treat people. Diagnosis is important because then we know how we're going to place our acupuncture needles, how we're going to, what kind of herbs to give them. Yeah? So, the concept of acupuncture, again, very fascinating. As you see here, this is auricular acupuncture. So, auricular acupuncture is done because the ear is actually a microsystem of the body. It's a microsystem of the body. The palms of the hands are a microsystem, the soles of the feet, the scalp, and the ear. And if people cannot handle the needles going into their bodies, it's just too much for them, the ear is not a bad place. It sounds freaky deaky. It sounds like, oh, I wouldn't want a needle in my ear. But you actually don't feel it. It feels like someone's just kind of touching it, along with one particular area. My throat affected my voice in a way, I don't even know if I can simulate it, but it was kind of like this. That's how swollen it was. When he started manipulating the needles in the ear, it went from that in real time to what you hear right now. He said, he told me while he's doing it, you hear yourself? I go, yes, I do. He goes, it's working. I go, obviously. So there's something, again, to how our bodies are connected. I know that this is something very hard to accept. It's tough if you're hearing this for the first time. But our brains are so much more connected to our body than we think. Our brains have so many intricate systems and are affected by so many different chemicals and biochemistries and immunology and all these antibodies and everything that are going around. If you keep an open mind, this can actually help somebody. And next. Cupping. There's cupping. I won't get too much into this because I want to be able to make sure I'm within time. But this is what we learn as well. There is suction cupping, heat cupping. I think some people in the Middle East even practice hijama. So this is also something they do. Tui Na is the recognition of what acupuncture points look like in the back. It's not just massage. It's certain points on the area that they focus on. If a person's complaining of a certain symptom, you focus on that meridian or that point. And then medical Qigong and Tai Chi. So, as you can see here, this is just a simple drawing of the different types of meridians that are throughout the body, and then you see these points within the system, within the meridian itself. If a person's complaining of cough, headache, any of these symptoms, you can manipulate these areas through the needles, insertion of the needles to hit these points or any of the other points that exist on the body, and this might be helpful for them to decrease pain, to get rid of muscle cramps, to get rid of nausea. Some people feel short of breath or coughing or any of those things. We're not thinking cure through these methods. We're thinking treating symptoms, helping individuals feel better. So again, another picture drawing treats the blockages, the deficiencies. That's another thing that they use in traditional Chinese medicine. Looking at blockages, looking at deficiencies. That's how they diagnose. So what do? We promote the wellness by the free flow of energy, because disease is due to the imbalance of these things. Wellness is the free flowing. It's a concept that kind of makes sense. So let's talk about the needle itself. Here's a match. This is a bevel. This is a hollow bevel needle that we do for what? Phlebotomy, right? This is a sewing needle. So this is the acupuncture needle. It's very, very thin, very small. And the needle itself actually doesn't really hurt. What you should experience is what the Chinese call the qi, D-E-Q-I, the qi. And when you hit that point, and you hit the point well, you should feel an achiness. It feels kind of heavy, feels achy. And if that's what you're feeling, that's the response you should get when it's done correctly. So I won't go too much into this because I want to make sure I'm in time as well. But basically, our brains, our bodies, we're filled with all different kinds of neurons. How do we feel? How do I know that I'm able to press this, the right button? How am I able to walk? How are we able to sit? We feel uncomfortable, we shift our... It's all because of the brain. The brain, the neurons, everything that we're innervated throughout the whole body. We sense pain, we sense pressure. And so if you look at this from a very foundational level in neurology and in anesthesia, basically acupuncture is a neuromodulator. If you really looked at how inserting that needle, getting that the qi, and how the brain perceives the heaviness, that is part of how acupuncture works. Go ahead. So again, what happens is you get the sensation, it travels up the spinal cord, goes to the brain, and then you get a reaction and it comes out. This happens within milliseconds. So again, a neuromodulator, we'll just keep going, initiating a chain of different reactions that occur. And that's how we should look at how acupuncture is able to help us. Go ahead to the next one. There is these studies where acupuncture was looked at with a functional MRI. It was done in Harvard, if I'm not mistaken. And they did a functional MRI to see the areas of the brain light up when you placed the needle in strategic areas for certain problems. Well, of course, the functional MRI will light up because it's a reaction. So you expect it to light up. But it lit up in particular areas. It lit up in areas more so that had to do with the area of the brain that it's the highways and the byways that come together when emotion is involved. Because when people experience pain, they're pretty upset. So you have chronic pain, that person can have depression. They're going to have sadness, they're going to have isolation, or whatever it is that that person is predisposed to. Interesting that those areas persistently would light up in different people. Because it's a neuromodulator. So this is one of the science that's kind of showing us how acupuncture is affecting our bodies. And in the US, where I work, we're starting an inpatient acupuncture program. Acupuncture you hear in clinics. You go to the doctor, you were able to walk in, maybe you have some pain, but it's not a serious type of thing like congestive heart failure or maybe cancer. When you're in the hospital, it's not well accepted to do acupuncture in the hospital. There's issues with that, and in our hospital, they're open enough to consider that to start a program. So, MD Anderson in the States, yes, right, it's in Texas, and they did a study. In 2018 was published, where they were able to do acupuncture on day number 1 and follow-up visit. So day number 1 and follow-up visit for symptoms like pain, nausea, anxiety, and drowsiness. And guess what? It helped them. If we are able to utilize acupuncture and non-conventional methods to avoid the pharmaceuticals as much as possible, it's worth doing. Why? Didn't we talk about the burdens and the benefits? If the burden is low and the benefit is high, it's worth pursuing. It's worth exploring. And so they showed, even through follow-up, that the individuals were able to sleep better, have less anxiety, and less pain. If we're able to decrease the amount of opioids with the opioid crisis that we have worldwide, and if we're able to decrease the side effects of the pharmaceuticals, I think it's worth pursuing. Okay, basically another study that showed that acupuncture for breathlessness was helpful in advanced disease. Let's move it forward. So, on the plus side, you cured my back pain. Thank you, Mr. Porcupine. Okay, so that part was the traditional Chinese medicine part. I'd like to kind of move a little bit more towards nutrition. So we'll talk about food, and let food be thy medicine and medicine be thy food. I think that's a wonderful quote. He who takes medicine and neglects the diet wastes the skills of the doctor. That's more important now, I think, than ever. So, here's a question. Is lifestyle killing us? Yeah, I think it is.
Yes.
I think it is.
Supermarkets.
If we can go back. Sedentary lifestyle, the potato head. Obesity because of bad food choices, smoking, alcohol. All the things we don't want to give up, right? But if we're able to work with our patients slowly and they're motivated, again, I say it again, it's worth pursuing. Now you can. Grave threats to our public health and mortality, the numbers show it. The numbers already show that people who are dying of heart disease and cancer are huge numbers. Go ahead. So, path to healing, the basics. Think about nutrition. Think about treatment guidelines, which one is low risk. Look at lifestyle improvement. Here's another thing for our physicians in the audience. Nutrition is also found a way to not only help patients feel better, stave off disease for a longer period of time, but also reduce costs. Now maybe that's not so much of an issue here in the UK because of the different, maybe it is, I'm not sure. But in the US it's a big problem. Go ahead, the next one. We're actually spending billions and billions of dollars because of heart disease and cancers and the treatments and the lost wages and the lost work time. Again, another slide where I'd like to kind of point out how we look at the randomized control trials as one of the top trials. And so if we do a randomized control trial, doctors tend to kind of stay away from certain issues saying, well, we really don't know too much about that. Granted. The N of 1 trial is actually starting to come out more and more. The N of 1, N, number 1, means that one person. It's back to the experiential observational studies that the Chinese were using for thousands of years. It's full circle almost. So this book was written by this individual who, it's his experience. My Harvard documented remission of incurable cancer. Basically, he had a blood cancer and was told at some point he's going to die of his disease. So it's just a matter of time. You need chemotherapy. Let's take out your spleen, start chemotherapy. He went through a journey. He went through a journey of trying to find out how to do things, not just through Western medicine, but through a different style of medicine or treatment. So he did integrative medicine. He found a clinic in Chicago that practiced integrative medicine. And he did those things. Stress was the big, for him, stress was awful because of his work. He quit that work, focused on mind-body modalities, changed his diet. Not a cure. We cannot tout cure when it comes to these things. He had his splenectomy, but went through a course, a journey, where he documented, he went to an oncologist and said, I want you to do a bone marrow on me, and documented no disease. Now, there's aspects to that. I understand for us who are physicians are going to say maybe it was a different place in the bone marrow, they didn't catch it, and there actually is another place that is the actual cancer. Okay, I think that's a good inquisitive mind. We need to think about those things. And yet, he's doing fine right now and did not do chemotherapy. So, what he's saying through this book is don't do exactly what I did. What he's saying is, I'm the N of 1. This worked for me. For you, it might be something different. It might be that you do chemotherapy, but you think about the other aspects that can help you so that you can move forward with that chemotherapy. I chose not to, but I'm doing fine right now. Everyone is an N of 1. Everyone here is our own N of 1. So go ahead and move forward. So very nice studies. This is another, I follow these individuals in terms of the studies that they put out, the publications. Very nice organization, Center for Health Law and Policy Innovation at the Harvard Law School. Basically put out helping us know that food is prevention. And here, look at the numbers, and when it comes to certain types of diagnosis, cancers, heart disease, and obesity, in the billions. This is how much we're wasting because of the situation we're in the US. And these individuals found that food is not only preventative, helps you with preventive issues, it helps you with treatment. I can't tout cure. I don't think I can tout cure, but I can say treatment. And so food being medicine is possible because they put out a white paper in 2015. And what they found was that when individuals were coming to the hospital sick with their chronic diseases of diabetes, heart disease, and things like this, when the hospital put forth money to help individuals who were in food deserts, meaning there was no apples or oranges or good food, they sent them food to their home. And these individuals ate only what the hospital sent them because they had no money. They had no means of buying good food. So they ate whatever was given to them at the door. Those individuals had, if you can go to the next slide, they had less length of stay. They were 37% shorter length of stay in the hospitals than their cohorts who weren't given that type of a diet, that type of nutritionally prescriptive meal. The individuals who were hospitalized didn't have to go to a nursing home. They went back home. It affected their length of stay, it affected the number of admissions to the hospital, and it affected where the destination was after they were discharged from the hospital. I think that's pretty powerful. I think that's pretty powerful numbers. And that's just looking at food. We're not even talking about acupuncture, lifestyle, sedentary. We're not even doing that. So I think that's pretty good. Just more studies basically that are showing us they're trying to do more in terms of the type of studies doctors are into so that they can look at diabetes and heart disease and things like this. And basically, even though the numbers are small, because food studies are tough. People tend to try to, yes, I ate my fruits and vegetables. I ate my fruits and vegetables, but I want a little chips right now. Oh, no, I didn't eat chips. So it's, food studies are tough because sometimes we're not very truthful when it comes to what we actually ate, right? But it's still showing good numbers. They're small, but they're getting there. The healthy plate, what is the healthy plate? What if our patients tell us, well, I don't know what to do. What am I going to do? I don't like broccoli. Well, the healthy plate, you can always, this is a very easy thing. You put one down, cross, try to fit it more with vegetables, try to fit it more with fruits. You get the healthy proteins and the whole grains. Instead of fruit juices, you look more at water, right? You try to decrease the chemicals. You look at the Mediterranean diet, the pyramid. You look at lifestyle. These are the lower part of the pyramid means you want to do more of this and less of that, right? So that way you're not completely abandoning yourself and saying, I fell off the wagon, and then you start eating the bad diets again. Forgive yourself, love yourself, and go back to what's good for you. Okay, let's go to the next one. And basically, what we all should know. Superior doctors prevent disease. Mediocre doctors treat impending disease, and inferior doctors actually treat the disease. If you told me that in residency, I would have fought you on it. Because I put in Swan-Ganz catheters and A-lines, and I intubated patients, and that was the real doctor. Sorry, Noosh. Yeah, not really. The superior doctor really is the one that's going to help you with well-being. Yeah. Physical prescription, Tai Chi, Qigong, yoga. We can talk more about that afterwards. So a study basically showed that there was significant improvement in certain symptoms: fatigue, sleep difficulty, they slept better, depression, and overall quality of life by utilizing Tai Chi and Qigong for individuals who are cancer survivors. Good quality of life. Shouldn't that be part of our prescription in palliative care or any of our specialties? Okay. Another one, influence of yoga on individuals when it comes to fatigue. Basically moderate intensity for several weeks. This is a short study. They didn't do a longer study, but the numbers basically show that you have better quality sleep, and so those individuals will probably be able to get more of their treatments through oncologists instead of having them delayed or decreased in their dosage. Again, small study, not too long in terms of the prospective longevity, but good numbers. So oncologists should actually consider prescribing things like yoga, just like we do with the social prescription. Okay. Biofeedback, another technique that's used in terms of mind-body awareness, using breath modulation, focusing on the breath, focusing on relaxation. There's actual physiological changes in our bodies that occur through biofeedback. Our pulse can decrease if we're anxious, can actually decrease. Our blood pressure can go from high systolic to a better systolic number. Our sweat glands, we're not as sweaty, we don't feel as nervous when we're able to actually be present, right? So biofeedback are other ways to help us. Breathing techniques, which we can do later on actually if you're interested, but for the sake of time, I'll just have you guys aware that's helpful. So what's our conclusion? Recognize that there are symptoms related with chronic illness. Those symptoms exist with all of our patients who've been diagnosed with serious illnesses, and they get worse over time. This is the trajectory of disease that we see, right? Hopefully I was able to help you all understand what integrative medicine is all about, and hopefully inspire you to consider integrative medicine in your practices and think about these things as part of the holistic approach to help patients, because there is a synergistic value between conventional, non-conventional methods, not just in palliative medicine, but all of our specialties. I know surgeons who are practicing this because they're passionate about it. So we reviewed several of the non-conventional methods. I want to thank you all. Thank you for the time that you've given me to talk to you all. Are we okay with...
Yes.